Hello, everyone. My name is Dr. Jessica Katanga, and today I present to you HEAL Module 6 on muscular and joint health. So today we're going to be talking everything arthritis, autoimmune diseases, and vitamin D deficiency. So let's start off with a case scenario. So we have Aisha Thompson, who's a 32-year-old Black British teacher, and she used to really enjoy her work and activities and hobbies. But recently, she's been having persistent muscle and joint pain, especially in her shoulders, back, and knees. And this has impacted her quality of life and has led to her not being able to teach as effectively as usual. So she went to her GP, and after consulting her GP practice multiple times, she felt like her concerns were being minimized. But finally, she was referred to a rheumatologist, and she was diagnosed with vitamin D deficiency and rheumatoid arthritis. Okay. So arthritis and autoimmune diseases affect millions globally, but they have a heavier impact on the Black community, and this often goes unnoticed. Arthritis involves joint disorders causing pain and stiffness and can be worse with age. Autoimmune diseases occur when the immune system mistakenly attacks normal body cells, affecting various different body parts, and this can happen at any age. So, prevalence. According to the CDC, nearly 50% of Black individuals over 65 have arthritis, compared to 40% of white people at the same age. Autoimmune diseases are more prevalent and severe in the Black community. For example, lupus is 2 to 3 times more common in Black women than it is in white women. The impact of vitamin D deficiency. Now, vitamin D deficiency can cause muscle weakness and fragile bones. It's also been associated with increasing the risk of conditions like rheumatoid arthritis and lupus. Adequate vitamin D levels lower the risk of multiple sclerosis. Multiple sclerosis is an autoimmune disease that damages our nerves. And this was found that vitamin D is a protective factor in the Journal of American Medical Association. Why vitamin D is particularly important for us Black individuals. An American Journal of Clinical Nutrition found that 82% of Black adults lack vitamin D compared to 31% of white people. The higher melanin in our skin reduces vitamin D production from sunlight, potentially contributing to this increased arthritis and autoimmune diseases that we see in our community. So addressing this deficiency is crucial. These are just some of the challenges faced by Black individuals in diagnosing and treating muscular and joint issues. So 1, there's lack of representation of us in clinical trials. 2, socioeconomic factors. 3, the cultural competency of healthcare professionals. And 4, the vitamin D deficiency. So socioeconomic factors could include, we might have more physical jobs in the first place. We might have jobs that we can't afford to take time off of to visit our GP. And then the cultural competency of healthcare professionals, as we saw in our case scenario from before, she was going to her GP, but she felt that she was being ignored multiple times. So the importance of lifestyle modifications in managing arthritis and autoimmune diseases. So exercise and physical activities. So as much as arthritis can come from, repeated wear and tear, it is still important that we exercise our bones. So things like weightlifting can increase bone density. Things like swimming is a great non-weight bearing exercise that is also great for our bones. And dietary adjustments. So we want to avoid those inflammatory foods. So being careful of spicy foods or heavily salted foods, as these can be drying to our cartilage and to our bones. And make sure we have a lot of varied, balanced diet including that fruit and veg, and a lot of water. How to improve vitamin D levels? So yeah, get enough sunlight. So for us, because of our melanin, we need to be out in the sun for about, in the summertime, say about 40 minutes is the recommended amount per day. And in the winter, of course, this is harder to get the sunshine if you are living in a more colder country. So that's why we can get the vitamin D supplements. But if you're lucky enough to be living in Africa or Caribbean, then make sure you're getting that sunlight every day. Maintain a balanced diet, as I said, and regular checkups. So make sure that you know what your blood results are, and what your blood tests are. What are your vitamin D and iron levels? The role of exercise. So I mentioned some of this. So strength training. That strength training really is increasing our bone density. Aerobic exercises such as swimming and running, that just improves our cardiovascular system. And if our cardiovascular system, if you have good circulation, then that includes good circulation to our bones. A lot of people forget that bone is a lot of blood. Most of our bones, there's blood runs through all of our bones, and they're very blood dense. So cardiovascular system is only going to benefit your bones. Flexibility exercises, so that's good for our, the tendons and ligaments, our joints, to make sure that we're flexible. And balance exercises, so they can recommend for older people things like Tai Chi and getting that balance, so that we can avoid falls in our old age. So conclusion, it's important for Black people to ensure that we have enough vitamin D. It's also crucial to acknowledge and address the impact of chronic stress, high trauma load, and lifestyle on the risk of arthritis and autoimmune disease in the Black community. Okay, so here are some of the references, and thank you so much for tuning in to today's class on muscular and joint health. I really hope you learned something, and we'll see you in the next one. Bye.